We want to make sure that when people go to healthcare facilities in Virginia, that they have confidence and trust that they will receive quality of care and that they are safe in those environments.
The state's highest-ranking health officials say change is coming to protect some of Virginia's most vulnerable, nursing home residents.
We feel really good that we're going to leave this industry better than we found it.
Health and Human Resources Secretary Janet Kelly and State Health Commissioner Dr. Karen Shelton sat down with CBS 6 for exclusive interviews to discuss Governor Glenn Youngkin's newest executive order. It aims to strengthen the oversight of nursing facilities across the Commonwealth.
I think we all realized as people were coming forward, and thank you for your reporting on this to kind of help shine a light, but as others came forward and the complaints mounted, something different needs to be done, something more has to be done.
The governor's order comes after a year of CBS 6's investigative reporting into the health department's shortcomings and holding facilities accountable. We've highlighted the voices of many family members with concerns about low-quality care.
I regret putting my mother in a facility.
They were doing just bare minimum care for him.
Disgusting, deplorable. Any words you can think of that's horrendous is the word for it.
And yet, the understaffed Office of Licensure and Certification, or OLC, ranks next to last in the country for timely inspections, also known as surveys, and has struggled to investigate a skyrocketing number of consumer complaints.
That raises a red flag with us, and it's our job to look into that and to say, what's going on, why is this happening, and how do we fix it?
How has our reporting played a role or made a difference in these efforts?
Oh, it had a huge impact. We only have so much we can do inside the government to raise awareness, to build public will, to make sure that the General Assembly is knowledgeable, and your reporting really helped with that. All three of those things happen, I think, as a result of your coverage.
So would you say that it helped bring us to this point today where we now have this executive order on the books?
Absolutely.
The executive order directs the OLC to automate and modernize its operations, including the process for handling complaints, to accelerate training initiatives, and to fill all of its open inspector positions by December 31st. The vacancy rate currently sits at 42%.
And do you think it's a doable goal to have all these vacancies filled by the end of the year?
We are pushing our hardest and we look to achieve that goal.
The order also establishes a Nursing Home Accountability and Oversight Advisory Board. It'll consist of various stakeholders and advocates to advise the governor and commissioner on policies that will improve care and resident well-being.
The legislators often ask, what can we do? And so it's great to have a team come together that we can all brainstorm together and say, these are concrete steps that we can take.
What would you say to the person who might be seeing the story and they're thinking, you know, it sounds nice to have this advisory group and a stronger OLC, but how will it actually make a difference for my loved one who is in a facility right now?
I think they'll be very encouraged. Right now, we're about half staffed, and so having a full team will make sure that we're hitting those surveys on time, and we'll make sure that we're doing it in a timely manner so that their loved ones are cared for.
Meanwhile, the Virginia Healthcare Association, which represents the industry, is expressing skepticism. They say that OLC has not received the necessary funding to fully implement the recommended measures within the proposed timeframes. Effective oversight requires adequate resources, and without them, the success of these initiatives will be limited. We asked Governor Youngkin whether his directives could be achieved with just a few months left of his term.
The short answer is yes, and we're racing through the finish.
Shelton says that new leaders are now in place at OLC, ready to carry out the mission. And to those who have voiced their desire for change, she says she listened.
The voices matter, and these voices coming forward has been very instrumental.
We're also hearing from several provider and consumer advocacy groups reacting to Governor Youngkin's executive order, and most are expressing overwhelming support. We're going to post all of their statements on WTVR.com. I'm Tyler Lane for CBS 6 News.
It stressed me completely out.
The conditions and care at Henrico Health and Rehab in the East End remain a major concern for the families of some residents.
The place is crazy. It's like a madhouse over there.
Among the documented complaints, slow responses to call bells, residents sitting in their own waste for long periods of time, and medication errors.
If you're not taking care of them to get them healthy, how are they safe?
This has been placed by CMS as a special focus facility.
Regulators have now identified this facility as Virginia's worst performing nursing home and enrolled it into a federal program reserved for so-called special focus facilities that rarely address underlying systemic problems that give rise to repeated cycles of serious deficiencies which pose risks to residents' health and safety.
Persistent record of noncompliance leading to poor quality of care.
In the last 2 years, state inspectors have cited the facility for violations including neglecting incontinence care, inadequate staffing levels, and 4 instances of sexual abuse against residents. And the Centers for Medicare and Medicaid Services have imposed fines totaling hundreds of thousands of dollars.
You take their money, you hit them where it hurts, in the pocket.
Henrico Health and Rehab spokesperson Mindy Barnett tells CBS 6 that they're currently operating with appropriate staffing and working tirelessly to enhance training and education, aiming to prevent any future issues and to ensure the highest standards of care are always met. This is a for-profit nursing home, which according to Medicare was operated by Medical Facilities of America during the reporting period. MFA had more than 30 other facilities across Virginia in its portfolio, and that includes Colonial Heights Rehabilitation, Glen Burnie, and Westport, all of which have recently been subject to enforcement actions. However, Barnett says the facility is independently owned and operated.
The first problem would be Medicaid. Medicaid stop paying them, I bet you get their act together, because most of their patients are Medicaid.
CBS 6 obtained cost reports to track how the facility has been spending its money, since most of the nursing home's residents are insured through the taxpayer-funded programs Medicare and Medicaid.
What I noticed, the big takeaway was the increase in rent that they're paying themselves for the building.
Valerie Gray, a forensic accountant who specializes in analysis of healthcare facilities, analyzed the numbers for CBS 6. She first points to rent money that Henrico Health and Rehab paid to another company under the same ownership, which is called a related party transaction.
And so they control, what they charge themselves for rent.
And the cost of that rent has gone up significantly from $1.6 million in 2022 to $3.1 million in 2024. Those numbers in blue are much higher than the figures in green, which represent what Medicaid would cap Henrico's rent and capital cost at using its fair rental value system.
It's an exceptionally huge increase. In the last year of the current ownership, the rent comprised 20.5% of their total operating expense. So one of every $5 spent to run the facility was leaving the facility to go pay rent to the owners through another LLC.
So what does this mean for the money left over for direct care?
Fewer dollars that are going to go to take care of the people that they have accepted into their care.
Barnett tells me the capital expenses are justified as the facility spent over $500,000 to upgrade the care center following a 2021 change in ownership. She says that included new beds, comfortable new chairs, and new oxygen concentrators. Barnett also says these investments and current market conditions resulted in a rent increase, which includes interest, insurance, property taxes, and certain maintenance expenses to the owner of the building. When asked whether the real estate cost limited resources for direct care, Barnett did not provide an answer.
When I see that and realize what has happened and the complaints and the sexual violations as a part of that, it's egregious, just appalled that those kind of funds are going toward a LLC or maybe a building, but not providing the care for the individuals who are in that building.
State Delegate Dolores McQuinn represents the area where Henrico Health and Rehab is located. She tells me she's been meeting with local, state, and federal officials in the wake of our reporting, but says she's concerned there's a disconnect between the agency that inspects for care and the agency that allots Medicaid dollars.
It could have been much more attention and focus on those nursing homes if there was a better understanding of what people were doing, what they were responsible for, and how they were executing. If the quality of care is not provided, someone should not be getting paid.
While the facility claimed an overall $141,000 loss in 2024, Gray says that does not account for any potential profit the owners made from the related party transactions.
Generally, what they're doing is transferring the profit to another entity, so it makes it look like the nursing home isn't making any money.
If this sounds familiar, we previously reported that Colonial Heights Rehab, which again is owned by the same company and has been the subject of 2 elder abuse investigations, raised its rent payments to a related party landlord from $2.6 million in 2022 to $6.1 million in 2024. Barnett told us that was believed to be fair market value, but lawmakers in that district say they're alarmed.
And there's a lot of these bookkeeping tricks that are being used that are siphoning money away from where the money should be going, which is patient care, and being used as profits.
Recent research shows similar trends across the industry, including a 2024 Federal Inspector General report, which suggests that some owners and private investors do not properly disclose or adjust related party costs, resulting in overstated expenses and underreported profits. To address this, a handful of states have passed laws requiring a certain percentage of revenues to be spent on direct patient care.
Is that something you think Virginia should consider?
Absolutely. We're going to be demanding that there be a restructuring of this situation.
Should we expect that you will be introducing legislation?
You can, I promise you, I will be introducing legislation. I promise you.
Encouraging news to those who say their aging family members deserve better.
They need to say, hey, let's be accountable of where the money is going.
That's our loved ones that they supposed to take great care of.
Somebody's got to step in and say, we're going to fix this.
The 2 state lawmakers who represent Colonial Heights stand ready to take action after CBS 6's investigative reporting on a troubled nursing home in their district highlighted what they say are gaps in Virginia's oversight system.
This is just the tip of the iceberg in terms of what many of these facilities are doing and the lack of care that's being provided to our most vulnerable citizens.
As Colonial Heights Rehab and Nursing Center remains at the center of criminal investigations, we took a deeper dive into its performance and financial history. According to public data, it's a 1-star, low-staffed, for-profit nursing home operated by Medical Facilities of America. We obtained the facility's cost reports that were submitted to state and federal regulators, and what we found caused concern for Republican Delegate Mike Cherry and Republican Senator Glenn Sturdivant.
Something financially there going on that doesn't look right.
Experts who reviewed the reports pointed to extremely large and unusual rent payments that were sent to a related party, that is, another company under common ownership. Records show that one entity owns both the nursing home operating company and a real estate company that leases the property back to the operator. And the price of rent increased significantly from $2.6 million in 2022 to $6.1 million in 2024. While analysts say that transaction likely generated profit for the parent company, it ultimately appeared as an expense on the cost report, contributing to what the provider claimed as an $89,000 overall financial loss that year.
When you see those kinds of numbers coming through a facility like that and then realize that they're ultimately paying themselves, it's almost a sense of they're cooking the books.
And then you compare that to see where the money is going, and they claim it's being spent in rent. That's a lot of money that is not going to hiring more doctors, more nurses, paying the folks better so they can get quality care providers to work at this facility.
A spokesperson for Colonial Heights Rehab maintains that the rent payments were fair market value and the professionals who submitted the filings have not been identified in any irregularities. But according to Virginia Medicaid's fair market value system, if every resident in 2024 was a Medicaid member, the facility would receive around a $1.8 million capital reimbursement. Now, related party transactions are not unique to Colonial Heights. Recent research, including a federal inspector general report, suggests that some nursing home owners and private investors do not properly disclose or adjust these costs, resulting in overstated expenses and underreported profits, which can typically appear in real estate transactions.
I think there is an industry-wide problem. The gaps in laws that have allowed what's happened in Colonial Heights, I think those same gaps exist throughout the Commonwealth.
Some states have already tried to crack down on those gaps. For example, New Jersey passed a law in 2020 that required facilities to report the ratio of revenues spent on direct care, and anything less than 90% has to be returned.
So that legislation was recently brought to my attention, and I think it certainly has some merit. I would love to explore that a little bit further and see if that's something that we can get accomplished here in Virginia.
The legislators say they're also interested in enhancing ownership transparency and scrutinizing the licensure process.
Should we expect to see some bills being proposed in the near future from you guys?
I think you'll absolutely see some bills in the next legislative session, probably from both of us, carrying both House and Senate versions.
I think we're also going to look at legislation that is going to try to unravel some of these bookkeeping tricks that, at least in Colonial Heights and probably elsewhere, are being used to siphon off money, taxpayer dollars, into profits as opposed to being put into the nursing facility to provide better care.
I also reached out to the Virginia Healthcare Association, which is the lobbying group that represents the interest of the industry, to get perspective from providers. A spokesperson told me in a statement that the association does support financial transparency and a proper balance of oversight, but she adds, the truth is that because long-term care is chronically underfunded, ancillary services and related parties sometimes help keep these facilities viable. If we want to transform Virginia's nursing homes, then we need to focus on proper investments and collaborative policies that will help them prepare for a growing elderly population. I'm Tyler Lane for CBS 6 News.
I wake up in the morning and it's like, what's next?
Ronald Rawlings says each day at Twin Lakes Rehabilitation and Nursing brings an unexpected challenge. He describes his experience living at the South Hill Long-Term Care Facility as inconsistent ever since new ownership took over.
At least at first, it was consistent at first, and now it's like, I'm just at the point now, it's like, okay, it's time to go.
VCU Health's Community Memorial Hospital used to operate what was called the Hunley Center, but sold the facility to the New Jersey-based Eastern Healthcare Group on April 1st, according to VCU Health. With it came the name change to Twin Lakes and a shift in ownership type from nonprofit to for-profit. Rawlings, who's lived at the facility since 2023, says one of the biggest differences he's observed is a decrease in the number of employees, as he alleges in a complaint to the Virginia Department of Health.
The nurses that are charged with my care are doing a very good job. Now, those nurses are working to the max. They are short-staffed.
He claims in his complaint that has led to medications not arriving on time and showers not occurring as frequently.
So before, when it was run by VCU, was it short-staffed like this?
No.
It wasn't?
No.
Rawlings says he has not yet received VDH's findings pertaining to his complaint, and Eastern has not returned a request from CBS 6 to respond to his allegations.
However, the Centers for Medicare and Medicaid Services, which regulates nursing homes, confirms a considerable drop in staffing levels following the acquisition. That data shows that the facility went from a 5 out of 5 star, well above average staffing rating from January through March to a 2-star below average staffing rating from April through June. Now, during that time period, the CMS data shows that under VCU, there was nearly 1 whole extra hour of reported nurse staffing per resident per day on average. According to some more data collected just before the sale, CMS gave the Hundley Center a 5 out of 5-star overall quality rating, which indicates that it performed well during health inspections. Twin Lakes has not yet had an inspection, but Eastern Healthcare Group overall has a chain rating from CMS of 1.4 out of 5 stars as of July 2025. And that indicates that the group's 17 facilities perform poorly on average on health inspections and staffing measures. Only 22 of the country's 600-plus nursing home chains have a lower overall quality rating, according to CMS. Now, we've asked Eastern for a response to the company's ratings, but we have not yet heard back. Rawlings tells me he's also troubled by past findings against the leadership put in place at the facility after the ownership change, as both the administrator, Shondell Samuels, and director of nursing, Latarsha Brown, have been recently disciplined by the state.
I think that probably sparked a concern for everybody's safety.
According to licensing board reports, Samuels and Brown were formerly in those same roles at Henrico Health and Rehab at the time of a 2023 inspection. Henrico was identified by CMS back in January as Virginia's poorest performing nursing home based off the results of its last 3 years and cycles of inspections. So, citing the outcomes of that inspection, the Board of Long-Term Care Administrators in July 2025 placed Samuel's license on probation, in part because they found she failed to protect residents from multiple instances of abuse. And earlier this month, the Board of Nursing placed Brown's license on probation, in part finding that she engaged in abuse of residents and failed to properly address neglect. We were there during a public hearing in November when an attorney for the state made that case to the board.
She, at the very least, allowed negligence or abusive behavior to go on at this facility on her watch, potentially that she even participated in it.
Brown denied wrongdoing and argued that she was a new director of nursing at the time with limited knowledge, and she told the board that she and Samuels were given direction by their previous leadership that she believes they would not have followed themselves.
I have very much taken responsibility for the actions that I played. However, I do know that in certain situations, some of these allegations, I know I was named, but I did not take part in them.
The board did not find her testimony to be credible, according to the case findings. Their probations mean that Samuels and Brown can continue practicing, but they're subject to additional training, reporting requirements, and state monitoring for at least 2 years. Board documents show that both women were terminated from the Henrico facility after that 2023 inspection. The Commonwealth began initiating proceedings against them in 2024. State records show the pair was working at Twin Lakes as of September 2025. We've asked Eastern if and when they were made aware of the licensing actions against Samuels and Brown, and if both are still employed at Twin Lakes, but they have not yet responded. I also reached out to Samuels and Brown directly regarding their cases, but they have not provided comment.
The state got to have some more oversight. They got to be held accountable. You got to hold them accountable.
Rawlings says while there are some bright spots at Twin Lakes, such as the dedication of the staff and the availability of activities for residents, he's worried about where the facility is headed under new owners.
Your way of business is failing. The things that's going on at Twin Lakes, like I said, hey, it just needs to get better.
I'm Tyler Lane for CBS 6 News.
I'm very, very proud of the progress that we've made.
Christopher Lindsay, a top official at the Virginia Department of Health, says the Commonwealth is delivering on its promise to make nursing homes better.
I've got to give Governor Youngkin a lot of credit here because he was directly involved in this conversation back in the summer. And we decided that this is something we needed to make some drastic change towards.
Lindsay has played a key role in implementing Governor Glenn Youngkin's executive order issued in August to strengthen the oversight and accountability of nursing facilities. The action was partly a response to CBS 6's investigative reporting, highlighting the concerns of families complaining about poor quality of care in record numbers
and VDH's failures to ensure timely facility inspections and complaint investigations.
I would say that you specifically, and CBS as a whole, have had an incredible amount of impact on this. Bringing a voice to many citizens that actually came to our advisory board was incredibly important.
So the executive order directed an overhaul with just 4 months to do it. First, VDH was to bolster staffing in OLC. With aggressive recruitment efforts, Lindsay says they've brought the vacancy rate of long-term care facility inspectors from over 40% to 9%.
Or are you seeing that inspections are starting to get done in a more timely manner?
We expect that to happen, yes.
But federal data that we researched shows 84% of Virginia's nursing homes are currently overdue for routine inspection, which should occur at least once every 15 months.
That number is actually worse than what it was this time last year, and it puts Virginia as the second worst state in the country for overdue inspections. How do you square that with what you're saying are the successes of this executive order?
The fruits of this labor are going to take some time to come. And I think it's important that the effort that we've put in now, next year you should see a far different outcome. What this complaint portal will allow us to do is more accurately triage complaints as they come in, more accurately assign them, and lead to faster outcomes in these surveys.
Further, the governor established an advisory board to come up with recommendations to improve care. Health and Human Resources Deputy Secretary Leah Mills says it aimed to amplify the voices of residents and dedicated advocates.
141 nursing homes are on the nursing home abuse watch list. That is totally unacceptable.
3 total meetings were held, and CBS 6 attended all of them.
To allow corporations to purchase and operate these homes as profit-driven enterprises is wrong. Because what happens is that you have profit over quality of health.
While the board's final report is expected in January, preliminary recommendations include addressing VDH's authority to deny the sale of nursing homes to owners with a poor quality history and private equity's involvement in the industry.
There's lots of external parties from Virginia that come into the state and own many facilities, and I think we need to have a good understanding and provide the data for that transparency of ownership.
As far as what comes next, that question we directed to Governor-elect Abigail Spanberger. She did not directly answer whether she'll continue this executive order and instead broadly address the issue.
We need greater accountability. We certainly need to ensure that we're doing the nursing home inspections.
And if you ask Speaker of the House Don Scott, the governor didn't accomplish anything.
Regarding that executive order, that's like a last-minute Band-Aid. That's just like, let me CYA, as opposed to fixing it. He had 4 years to fix this nursing home issue.
Well, respectfully to Speaker Scott, I think we've fixed a lot of things. This is not an effort that could have been undertaken 3 years ago or 2 years ago or even 1 year ago. A lot of our effort needed to be put to building up the financial house at VDH that allowed us to pivot more recently to accomplish goals like we're seeing in OLC.
How do all of the things that we're talking about translate into actual better care for the patients?
I 100% believe that more presence by VDH in facilities with trained inspectors and supervisors, we will start to see substantive change in the quality of care in Virginia's nursing homes.
I'm Tyler Lane for CBS 6 News.